Greetings, this is Travis Taylor, Healthcare Administrator and Educator, performing Voyager Home Healthcare General Orientation, Section 2.
All right, first we're going to discuss documentation. We will discuss the importance and reasons of documentation, define medical records, discuss the important information that needs to be entered into a medical record, and state the information that is necessary for claim submission. Voyager Home Healthcare has a duty and responsibility to provide high-quality services that are medically necessary to our patients, submit accurate claims to federal healthcare programs, manage accurate medical records, and documentation to support those claims. Documentation is important for three main reasons. 1. Patient safety. 2. Program integrity. 3. Provider protection. Let's discuss each one in detail. Patient safety includes accurate documentation that encourages patient safety and establishes high-quality care. Failure to preserve good documentation can endanger patient health. It would then turn into more than a paperwork problem. It also avoids unnecessary or duplicate services and prevents problems. It is very important for documentation to be complete, accurate, and legible. It ensures that patients get the best possible care. Program integrity consists of accurate documentation to ensure that we bill the right amount, people, which may sound simple but in reality can be quite complex, and programs. Provider protection covers good documentation to help us avoid the risk of fraud and abuse. Healthcare companies and providers can face stiff penalties for documentation and coding violations. Payments could still be at risk even if services were provided if documentation or coding is incorrect. 4 of the most common fraud and abuse issues that are related to documentation and billing healthcare programs are lack of medical necessity, billing for services not rendered, lack of documentation, and duplicate billing. It is more important than ever to make sure all of our documentation not only meets but exceeds all the federal and state program requirements. There are several areas where the documentation must receive special attention. They include medical necessity, homebound status, if applicable, physician's certification of the plan of care, face-to-face encounters, duplication of services, complete and thorough initial and ongoing assessments, supervisory visits, case conference notes. Let's look at these in more detail. Claims should only be turned in for services that are medically necessary and arranged by a physician. Services only covered by Medicare and Medicaid and by other federal and private healthcare plans when they meet appropriate medical necessity standards. The company has procedures and policies that include periodic reviews. Periodic clinical reviews include following and prior to billing of services, verifying that patients are accepting only medically necessary services. Also, during these reviews, the company examines the frequency and duration of services and determines if patients' medical conditions warrants the visits provided and billed. Patients must be deemed as homebound for Voyager to be reimbursed for home health services under Medicare. Patients must be presumed homebound to be qualified for services. There must be proper documentation. Patients should be unable to leave home easily or require a considerable effort to, and they should be certified by a physician that the patient met homebound status. Claims submitted for reimbursement for home health care services should have supporting documentation and services authorized by a physician. The plan of care must be established, dated, and signed by the qualifying physician. It must be considered every 60 days by a physician in order for the patient to continue qualifying for coverage. It can only be billed if the services are medically necessary. Physician orders must accurately be documented. All other care needs should be reported to your supervisor immediately. A face-to-face physician encounter is required. Physician and patient must meet face-to-face, required for Medicare patients accepted into home health care services. It must meet this requirement for face-to-face encounter within 30 days after the start of care or 90 days prior to admissions to home care. And you must have a physician certification and documentation of the encounter filled filed in the patient's medical record prior to the final claim for billing. In addition to providing excellent care, it is important for all employees to know the key elements that must be in the medical record in order to accurately document the medical care provided. The medical record is a legal document. The purpose of it is to plan for patient care. It is information about medical treatment, a permanent record, patient history, and a communication between doctors. Patients could be seeing more than one doctor for different reasons, it should be noted. Submitting a claim should always have complete and accurate supporting documentation, the record entry reason, the full name and title of the person administering services, information needed to support medical necessity, and other relevant reimbursement coverage criteria. Processes exist to review claims before they are submitted. Pre-submission is before they are submitted. Post-submission is after they have been submitted. To ensure that we are submitting claims accurately and that claims represent medically necessary services. In order to deliver care, caregivers are required to keep current professional licenses that are free of infractions. Documentations must be kept in the clinical's personnel file. Annual skills checklists are conducted and are required to be completed by a supervised clinician by all clinician-provided care. Skills checklists may be conducted more frequently if needed. These reviews ensure that the clinicians are maintaining their professional licensing and care being provided is at the highest level of quality. When skilled nursing is not ordered, care administered by assistants or aides must be overseen by a registered therapist or nurse. These oversight visits must be accurately documented in the medical record. The goal is to improve care for the patient. It is common for more than one healthcare provider to supply similar type of care. A full assessment must be completed at intake to effectively document the patient's condition at intake. Leaving out sections or failure to enter information can result in poor documentation and maybe put the patient at risk. Creating treatment plans for all types of providers is applicable for treating the diagnosis reported in the medical record. Ongoing assessments in the course of treatment ensure that patients are always receiving the proper care. Also, to ensure that services are not submitted for reimbursement of duplicate services. Care teams must schedule efficiently and effectively. When documenting in medical records, these are the things you should do. Date, sign, and time all entries. Include first and last name. Title and use AM and PM abbreviations. Write first-hand accounts only. Clearly state what you saw and what you did. Document all efforts and steps taken to correct patient care issues. Include entries of things that didn't happen when they were supposed to. Keep all entries factual, specific, and objective. These are the things you should not do. Leave blank spaces. Use ditto marks. Chart on behalf of another provider. All entries should be for services only you provided. Chart ahead of time or chart an action that did not take place. Now we're going to talk about modifying documents. When modifying documents, no one is perfect. Modifications are permitted, but all changes must be made according to the company. Corrections or late entries should be made only when you must add information, forget to write notes, or misstate something in the original entry. When corrections are necessary, draw a single line through the entry and initial and date the entry. Do not use any type of correction fluid or tape and never erase or white out anything.